Welcome to Culture. Cultural diversity is the coexistence of different ethnic, racial, and socioeconomic groups within one social unit. These groups can include many different variations from religion, language, age, sex and gender, disability, occupational status, even geographical location. It's important for nurses to know and understand what cultures are prominent in their healthcare setting so they can be familiar with and be sensitive to the needs of the different groups. Cultures share a system of beliefs, values, and behavioral expectations and provides a structure for daily living. Culture influences the roles and interactions with family, friends, and their communities. We do need to be mindful that many people identify with multiple cultures, ethnicities, and racial groups these days, and that makes culture and self-identity very person-specific. We can't assume that someone identifies with one aspect of their life and not another. We're all individuals, and we need to be treated and treat others as such. When we think of cultures, we need to be mindful that we have dominant groups and minority groups. Dominant groups are usually the largest group or culture, and this group has the most authority to control values and sanctions in society. Minority groups are smaller and they have physical or cultural characteristics that identifies them as different from the dominant group. This aspect is really important to remember when we talk about health disparities later. Ethnicity is usually based upon someone's heritage or even their genetics. People within an ethnic group share a unique cultural and social beliefs and behavior system, as well as language, religion, music, and food preferences. Ethnicity usually develops through a day-to-day interaction with their family and friends within the ethnic community. Race and ethnicity often get used interchangeably, but they're actually different. Racial characteristics are usually based on specific characteristics like skin pigmentation, body structure, facial features, and hair texture. But so many people are multiracial that physical characteristics are no longer a way to determine someone's race. There are 5 federally standard races in America. These include Native American or Alaskan Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, and white. Many people identify with more than one of these races. There are several factors that keep people from being sensitive to diversity in cultures, ethnicities, and races. And the first is stereotyping. Stereotyping is when we assume that everyone in an ethnic, racial, or cultural group is the same. Stereotyping can include racism, ageism, or sexism, and these beliefs are that age, race, or gender is superior to another one, and it leads to discrimination. Implicit bias is when we have attitudes and beliefs about people different from us, and we don't even consciously know that we have those biases. Cultural imposition is the belief that everyone else should conform to our own belief system, and cultural blindness is when someone ignores differences in people and acts like they don't exist. These factors can cause cultural conflict where people feel or are threatened, ridiculed, and have fear because of their values. America is a multicultural, multi-ethnic, and multiracial country. This makes our healthcare system a very diverse place to work and to be a patient. There's so many things that influence our patients' health and wellness, and many of these affect how we provide care. When it comes to physiological variations in our patients, nurses need to be aware of and mindful of some of the hereditary disorders our patients face. People of African American descent are at higher risk of hypertension and stroke. Hispanics are at higher risk for diabetes. Native Americans are at higher risk for heart disease and liver cirrhosis. And these are just a few of the things I can name, and there are so many more. Different groups react to pain and disease differently, and others have very specific views on food and nutrition and how it relates to wellness and illness. Family support, or lack thereof, can be very diverse based on cultures and ethnicities. Language and communication barriers absolutely influence healthcare, as well as assigned sex roles. I'm going to use assigned sex as a way to bring up health disparities. Health disparities are certain people getting or having inadequate access to healthcare due to economic, geographic, linguistic, cultural, sex, education, income, and even insurance factors. These health disparities cause substandard quality of care, miscommunication, discrimination, stereotyping, and prejudice. So let's talk about these with assigned sex. Men who come to the hospital with chest pain get worked up for heart attacks. Women get worked up for anxiety. Because of this, women have higher rates of death due to heart attacks. Women's complaints get dismissed as hormonal related, and men get full workups. Let's talk about COVID treatment. American Indian, Black, Native Hawaiian, and Pacific Islanders and Hispanics had 3 times the premature death due to COVID than whites or Asians, along with higher rates of hospitalization. Yet all of these groups received less monoclonal antibody infusions and received less supportive therapies. People with sickle cell anemia, which is a very well known to be a very painful disorder, those patients usually get labeled as pain medication seekers despite having a well-known painful disease because sickle cell disease is predominantly in African American descent. I want you to try to think back to the beginning of the semester when we discussed health. Health is a definition that is very different from person to person because it's not just about the absence of disease. It's about their physical, mental, social well-being, all of this that makes a person very specific. How a person defines health can be very heavily influenced by their cultural, ethnic, or religious backgrounds. Some people believe that folk remedies and herbs help their health, and some believe that hot and cold affect their health. Other people believe in yin and yang, while others do not believe in Western medicine at all and only want alternative therapies. Some people believe illness is brought onto them by bad things they did in this life or in a past life. Some influences of culture include their diet, their family structure, and who can care for certain family members. Communication and eye contact and personal space is dependent on their cultural influences. Pain management and even death and dying are influenced by people's cultures. As nurses, we're members of a team that provides care for many different types of people, and our own team is made up by many different types of people. Because of this, we do need to be competent on different cultures that we may care for. I don't mean that we need to know everything about every culture, and in fact, so many people are part of many different cultures that I don't even think we can attempt to do that. But what I am saying is we need to be mindful that everyone is different and to be willing to learn about and understand what cultural influences our patient may have. The person in front of us is who matters most at that moment in time, and taking 5 minutes to ask them about the influences in their lives can change the whole way we provide care. To be able to do this, we need to be aware of our own thoughts and feelings. We need to know about our own biases and prejudices. We need to have the willingness to accept that our patients are different from us, and we need to be willing to accept that the person in front of us is not us. And we need to know that they deserve respect and dignity even if they're different from us. This can be very challenging as we were all raised with our own culture and ethnic and social norms, and sometimes our upbringing causes us to have biases and thoughts that don't allow us to be accepting of the people who are different than us. Besides understanding our own beliefs and being respectful and accepting of the people that are different than us, what else can nurses do to provide culturally responsible and respectful care? Well, we need to establish trust with our patients, which may take time. We have no idea how they've been treated in healthcare, and they may not trust us. I want you to Google the Tuskegee experiment. This will help you understand why people have distrust in healthcare. We want our patients to know that we respect them and their values and their beliefs. We do not have to follow what they do to be respectful, but we want them to know we respect them and have an interest in what we can do to make them feel better. This means we may need to discuss treatment options that fit with the patient's belief, including alternative therapy like herbal remedies and folk remedies. We may need to assess what they think is wrong and what they think could be causing the issue they have. We can also ask them what they think might help them improve. Many cultures do not believe that hospital food will make them better. If there are things we can do to accommodate their beliefs why they get better, we should try to do so. That may mean no male nurses caring for their elderly mother, or allowing the family to bring in food from home, or accepting the fact that they're never going to look us directly in the eyes. We can and should do these things if we can. If we need help, we can ask for help. Many hospital chaplains have resources for cultures in addition to spirituality, so we can use them. And we can talk with the family members, and we can even talk with people on our own healthcare team who may be the same culture as our patient. A critical component of a person's identity, just as important as culture and ethnics and religion, is their sexual identity. Sexual identity encompasses a person's self-identity, biological sex, gender identity, gender role behavior, and expression and sexual orientation. All of these factors play a role in how the person shows themselves in the world, but in healthcare, it's very important for nurses to be sensitive to the needs of our LGBTQ+ community and the health issues it can cause. The first issue we have is the mental issue we see in this community. This community has a lot of stigma associated with it, from the AIDS epidemic in the 1980s all the way to now. And with social media, the community is often treated poorly by the public and healthcare providers. So there are high rates of depression, anxiety, and suicide in this community. Part of the issues that we see in healthcare surrounding the LGBTQ+ community is our own perception and our own feelings surrounding people who have different beliefs than we do, much like what we see with culture and ethnicity. There's also a lot of confusion about sex and gender, and it's actually very important for us to know as healthcare providers. Sex is the physical or biological characteristics that distinguish men from women. This is our chromosomes, this is our hormones, this is our genitals. The reason why this is so important for us as healthcare providers is there are major differences in the risk of diseases, medication dosages, and treatments that are biologically specific. Body composition is different in the sexes, and that's all going to affect what we do as healthcare providers. But gender is different. Gender is socially constructed characteristics that say, hey, you're male, or hey, you're female. It helps us dictate how we speak, how we dress, how we act, and this is all taught to us, and it can vary person to person. When it comes to gender, there are no biological differences that pertain to gender in healthcare. We just treat the person with who they are. Because we're healthcare workers in a caring profession, we really need to be as caring with this community as we are with other communities we serve. We need to be open to listening to our patients and hearing their thoughts and feelings. We need to form a trusting relationship so they can talk to us about their issues. We can use neutral language that isn't gender specific if needed, and we can avoid making assumptions. Assumptions are just as bad as stereotyping. And we can confirm the patient's preferences. What do they want to be called? How do they want to be spoken to, or how do they want to speak to us? How do they want to be treated? In all honesty, we should not be treating the LGBTQ community any differently than we would treat everybody else, and that's with compassion and respect. And this is the end of culture.